Welcome to Hoosier Homeland, an Indiana Department of Homeland Security podcast. This podcast discusses and explores the latest news and insights in emergency management and public safety. Join us as we engage with subject matter experts and bring you the latest on how IDHS is working to provide Hoosiers with a safe, secure, and resilient Indiana. Sit back, relax, and let's dive in. In today's episode, we are diving into a critical yet often overlooked aspect of emergency medical services, pediatric readiness. When a 911 call involves a child, the stakes are incredibly high for EMS professionals. The pressure to get everything right can be overwhelming, especially given that the majority of their training and daily experiences are focused on adult patients. Pediatric emergencies, though less frequent, require specialized skills and equipment to ensure the best possible outcomes. In today's conversation, we'll be speaking with Kari Lanham, an experienced emergency medical technician and the EMS Training and Education Coordinator for the state of Indiana. Kari will share insights into the unique challenges EMTs face when responding to pediatric emergencies, the tools and trainings that are helping to improve care, and the ongoing efforts to make sure children receive the safest and most effective emergency care possible. We'll also discuss how communication, both with young patients and their families, plays a vital role in these high-stress situations. So whether you're a medical professional, a patient, or just someone interested in the inner workings of emergency services, sit back and let's start the episode.
My name is Kari Lanham. I am a paramedic and also a primary instructor. I have an associate degree in paramedicine that I got from Ivy Tech. Started in EMS back in the early 90s, 1992 to be exact. And I have worked for both private ambulance services, fire departments, also have a fire background. And I've worked for mostly rural EMS is my background, and which I really enjoy. I came to the state about 2.5 years ago. It'll be 3 years in April. And I currently am the EMS section chief. I'm the EMS Education and Training Coordinator. And I oversee all of the EMS programs in the state. And I also play a big role in the primary instructors and working with them on a daily basis as well, too.
Can you describe the unique challenges EMTs face when responding to 911 calls involving children compared to adults?
Absolutely. So the biggest thing is that there are far fewer pediatric calls than there are adult calls. So the other issue, too, is not only are you dealing with the child, and of course, pediatrics covers a very large age span, but you're also dealing with the parents, with the family as well, too. So these are low volume, possibly high risk calls. So that can make it very stressful for the EMS provider.
How have you seen the difference in confidence levels among EMS professionals when dealing with pediatric patients versus adult?
I think typically any EMS provider is always very anxious when they are responding to a pediatric call. I think this increases as the skill set goes up, meaning, as you become an advanced EMT or a paramedic, it becomes even a little bit more challenging. Paramedics are having to deal with medication dosages, cardiac treatments for pediatric patients, which is something that we don't do every day, fortunately. Mm-hmm. Sometimes it can be a little easier for some EMS providers if they themselves have children. Mm-hmm. They're a little bit more comfortable being around children, knowing how to speak to the children. And, some of our younger EMTs that are either graduating from a high school program or maybe even in their early 20s have not really had the opportunity to be around children. And so that really increases the stress level for those providers.
I'm wondering what steps have been taken by the state and your EMS division to improve pediatric readiness among EMS teams across the state?
We're real excited over having the money from the EMS Readiness Fund to be able to help fund some of our advanced life support providers in the state having Handtevy. Handtevy is a game changer. Handtevy is a program that allows the EMTs and the paramedics to very easily work from an app from their phone, which will allow them to not have to do that medical math in the middle of the night or during the day. I can't do math during the day, let alone in the middle of the night. So it's really taken the guesswork. Our goal is to make providers feel more comfortable. And by having an app like this, that really reduces the stress. And also it's reducing medication errors. Interesting enough, there was a study done, not in Indiana, but nationwide, that showed that children were less likely to get pain medication because the paramedic was hesitant regarding the dosage. And so with the Handtevy system, we're seeing that pain medication is being more appropriately given to the pediatric population.
Is that what the medical math is? It's usually the kind of different doses?
Yes. So medication dosages, for an adult, we always have our protocols that we work off of. Some protocols are maybe in an electronic format, and some protocols may be a book, a handout that is in the ambulance itself. We do, as a state, require protocols because in this state, we don't have state protocols. We have medical directors that make protocols. And so dealing with adults every day, day in and day out, we have a tendency to memorize those. And in the pediatric population, because their sizes vary so much, medication dosages can be a little bit more challenging.
Have you noticed an improvement in pediatric care outcomes since implementation of new tools and protocols like the Handtevy app?
I have recently talked to several advanced life support providers, and they have said that Handtevy has been a game changer. Their providers no longer are feeling as stressed with dealing with pediatric calls. They feel much more confident, and they have made it a point to make sure that they are training frequently in the pediatric population. And what's nice about Handtevy is that they can actually incorporate your own protocols for your service into the app, because what has been a challenge in the past is if you use the tool called the Broslow tape, another great device, low cost, great device, but it is a tape, so it's not an app. And the problem is the concentration of the medications on the tape can be different than what you have from your own pharmacy or hospital. And so with Handtevy, they are actually able to incorporate the concentrations as well, too. So your protocols are in that app. So there's no back and forth.
Received good feedback on that?
Absolutely. Absolutely.
How do you train EMTs to handle the high pressure situations that arise when responding to pediatric emergencies?
So currently the advanced life support services that have signed up to receive the funding and to offset some of the costs of the Handtevy system, they're actually able to send two people from their service to some of the designated Handtevy instructor trainer courses that we've been offering and Handtevy's been offering across the state. And what that is going to enable those services to do is to send those people to the training to become a trainer. Those trainers are then going to be able to come back to the services and train their personnel on the Handtevy system. Another thing I had mentioned was the Broslow tape. A lot of services, maybe if they weren't able to take the opportunity to receive this funding, the Broslow tape is another piece of equipment that our EMTs, advanced EMTs, and paramedics are trained on. And again, this is taking some of that guesswork out of not only medication dosages, but what equipment size is needed. So for instance, if you're going to intubate a patient and it's a child, it's going to tell you exactly what size piece of equipment you're going to need. Another example of ways that we have helped our EMTs and paramedics in the state is there are devices also, again, a low-cost device. You can buy them individually, is the PD wheel. The PD wheel is something that fits in your pocket. It also is another tool. It's based upon weight and age, and the provider can easily turn the wheel and know what equipment and what some of the common medication dosages there are. Often, our providers in Indiana are also utilizing a product that was it was invented here in Indiana by Lisa and Scott DeBoer, called Pediatrics, and they have some fantastic training simulations that can be used to help our providers learn more about pediatric training.
Have you noticed an improvement in pediatric care outcomes since the implementation of these new tools and protocols?
Definitely. Over the years, the training for pediatrics, I think, has become much more simplified and easy to understand, which is a big part of being able to take that stress out of the EMS providers' hands. By using tools, starting even from an EMT program, we teach them how to utilize tools such as the Broslow tape. That has been something that's been around for many years. And implementing some of these new easy cheat sheet, so to speak, has really made a difference in, I think, the education of our EMS providers.
So I know one of the tools in an emergency medical department's toolbox are Pediatric Emergency Care Coordinators. They're also sometimes known as pediatric champions. They're often responsible for ensuring EMS agencies and emergency departments follow national recommendations for pediatric emergency care. I'm wondering, what roles do pediatric emergency care coordinators play in improving pediatric readiness for EMTs?
So, unfortunately, in years past, it hasn't been a position that really has taken a strong role. Sometimes it's just been simply a name and a spot on our application or in the hospital ER. But I think we're really starting to see people step up to these roles. This is an extremely important role. This isn't just a role that's there to fill out a yearly pediatric survey. These people in this role, oftentimes it's the training officer, oftentimes in the ER it's a designated nurse. But these people play a critical role in helping us reach our first responders to make them feel more comfortable with the pediatric training. And really, this is something we need to really start paying more attention to. Providers just are not comfortable, and not only pre-hospital providers, but I'm talking, nurses and physicians in a local ER, especially a rural ER department. These providers, again, it's low volume calls. They can be very critical calls, and the hospital staff feels just as stressed as we do. So these pediatric emergency care coordinators play a critical role, and I really would like to see this position grow and offer more training.
From a state perspective, what can EMS agencies do today, right now, to make these coordinator roles more central to their pediatric strategy?
So I think we've started off very strong with, helping out with some funding to Handtevy. In the future, we would like to be able to fund, our goal would be to provide at least every advanced life support agency in the state to be able to utilize Handtevy to reduce those medication errors. And Handtevy is just not for pre-hospital use. This is something that is also used in the emergency department. So the pediatric emergency care coordinators really could play a great role in helping to become a Handtevy instructor and being able to teach their staff how to use the Handtevy system.
I'm wondering, one of the challenges and kind of fears is the how to safely transport children in ambulances. What are some of the challenges, and what is the importance of safely transporting them?
And this is not just a Indiana problem. This is a nationwide problem. So, of course, in Indiana, we do require, we want our patients and even our EMS providers, they all should be utilizing a seatbelt and the safety harnesses. If your cot manufacturer has made your cot to have a 4-point restraint system, you need to be utilizing the 4-point restraint system. But what's, challenging is for our pediatric population, there isn't very good methods out there to be able to safely transport them. And this is an industry problem. There are companies such as Stryker, which makes a lot of medical equipment, particularly cots and power cots, that they are actually kind of working on this problem now to see if they can implement something that their cot could have contained in it to help with, especially our young population that utilizes car seats. Of course, if this is a critical situation, they're going to have to be lying flat on the cot. But oftentimes, let's say we're doing a pediatric transfer, or if there was a car accident, we will utilize the patient's car seat, providing that it's, it can't be reused as a car seat, in their family vehicle, but we certainly can utilize that to help contain them, to get them to the emergency room. There is also a device that many of our providers have in the state called the PediMate, and it is a really nice securing device that can be used for pediatric patients from 10 pounds to 100 pounds, and it's easy to store. It's kind of it's basically like a car seat, but it's just easy to store. So right now, that is probably our best method, but we're always looking to research new possibilities.
How does securing a child kind of differ from securing adults in an ambulance setting?
So it is definitely more challenging because, newborns require securing devices that are much smaller than somebody that might be, 10 years old. And so to be able to have a car seat in an ambulance does take up a lot of room. And so it is difficult to be able to meet the weight and height requirements of our pediatric population. Pretty much everybody in our adult population, can fit into the 4-point restraints, seatbelts in the vehicle. But the pediatric population, the sizes is just really makes it more challenging. Some ambulance manufacturers actually have a built-in car seat in one of the, like we call it the airway seat that sits kind of behind the cot. And so oftentimes we'll utilize that as well.
How do you feel EMS agencies can support their personnel in becoming more comfortable and skilled in care?
Definitely, really heightening that position of a pediatric emergency care coordinator is one of the first steps. Having the ability to use Handtevy, of course, is another method. But, there are simple things now they can do, even if they don't have the financial means to be able to buy, some of the fancy equipment. They can do simple trainings with our sim lab, which is something that we offer throughout the state of Indiana free of charge. We even have a high fidelity pediatric mannequin, and we are happy to come to their facilities and work with them with pediatric training. There are also some pediatric bags that equipment can be put in that are color coded, which makes it very easy for providers to use that with the Brazilo tape or with Handtevy to kind of organize the equipment so the right size is there and it takes the guessing game out.
How does communication between EMS professionals and the families of pediatric patients help improve the overall outcome of the child?
So as I said before, what's unique about pediatric calls is not only do you have your pediatric patient, but you really have the family, the parents as a set of patients as well, too. And you can't forget about them. It's a very scary time for them. Even if it doesn't seem like it's an emergency to us, it's an emergency to those parents. So EMS providers must do their very best to help comfort the family of a pediatric patient as well. Sometimes, that family can be very overwhelmed with anxiety and grief. So, we may have one of our providers, one of our EMTs or paramedics are treating the child, while the other one is trying to calm down the family. Sometimes, giving them a simple job to do will help the family kind of ease their anxiety a little bit. Mm-hmm. But, and providers have to realize too that their anxiety may come out as anger by the patient, by the parents. And so we have to be empathetic to that, especially if you have, I always tell my EMT students, if you have a child that has a unique disease that you're not familiar with, those parents are experts in that disease process, and you need to use them as a resource. Ask them questions. Don't be afraid to say, I'm not familiar with this disease, because those parents are going to feel more of a sense of trust with you, and you'll develop that relationship. But it's real important to include them in this process.
I'm wondering, how has the relationship with organizations like the National Association of State EMS Officials help advance pediatric safety during EMS transport in Indiana?
Sure. So, NSIMSO, they are a group that is constantly making EMS better, not only for each state, but just as a nation, the entire country. They're an important organization because they help set standards and also help develop things such as, student minimum competencies, safety standards. They have a wonderful resource library on their website, which includes some reference documents of like best practices. So if an ambulance service wanted to know, what they recommend for certain situations, they can easily go to NSIMSO's website and look up what the best practices are for that particular situation. And we are real fortunate here in Indiana because our EMS director, Craig Kenny, actually sits on the NSIMSO board.
So looking forward, what additional measures do you believe could further enhance pediatric emergency care in Indiana? And what is the EMS division doing to further those goals?
So, Handtevy. I can't say enough about Handtevy. We are just so excited to be able to offer this. And again, our future goal is to be able to offer this to as many, if not all, at least ALS providers, if not basic life BLS service providers across the states. Can't say enough about Handtevy, but we as an agency are, actively looking. Director Kenny is looking to see what type of funding we might be able to qualify for to be able to offer the services across the state. And we have one of our EMS district managers, Travis Clary, has been actively working and helping Craig Kenny out with implementing Handtevy. He has set up several Handtevy instructor courses across the state, which have been very well received. So I'm excited. I'm going to be going to one in October up in the Valparaiso area. So this is just really the start of it. I really want to see our pediatric training grow.
Is there anything else you would like to add?
I will say that, we are lucky in the state of Indiana. We have many EMTs and paramedics that are passionate about treating our pediatric population and even our population that has certain disabilities. We are fortunate to have Matt Kodachek, who is a primary instructor and a paramedic out of Northwest Indiana. He has a son that has autism, and he has done both within their state as well as nationally. He's gone out to give lectures on autism and how, us as EMS providers, first responders, how they can be able to interact with this population. And he actually has developed something called Ben's Blue Bags, which are he gathers, he gets donations, and he puts all sorts of little toys in there that help with children's stemming, helps to ease the anxiety of not only autistic children and adults, but also children in general. We also have Tom Felter. He is also a paramedic from Northwest Indiana, and he and his wife Tina, who is a labor and delivery nurse and manager, they have a daughter that has Down syndrome, and so he goes around the state, around the nation, doing the Emily Talk. Who Emily is their daughter, and they actually even created a movie that has won Academy Awards called the Teacher of Patience. And he has really done a great job reaching out to our providers about working with kids that have Down syndrome. So, that's just two examples of providers that are going above and beyond for our pediatric population.
Awesome. Well, I want to thank you for joining me today, Kari.
Thank you so much. It was a pleasure to be here.
That brings us to the end of today's episode. We've learned a lot about the complexities and challenges of pediatric readiness in emergency medical services, and how ongoing efforts in Indiana are making a difference, from the use of innovative tools like the Handtevy app to the crucial role of Pediatric Emergency Care Coordinators. It's clear there's a growing focus on improving outcomes for our youngest patients. A big thank you to Kari Lanham for sharing their expertise and experience with us today. It's encouraging to hear how the relationship between EMS professionals and pediatric patients is evolving for the better, and what's being done to continue that progress. If you would like to learn more about the work the EMS division has been undertaking, go to in.gov/DHS/EMS. And as always, thank you for tuning in, and we'll catch you next time on Hoosier Homeland. This podcast has been a production of the Indiana Department of Homeland Security. If you enjoyed this episode, our complete catalog can be found on Spotify, YouTube, and Pandora. To listen to previous episodes, go to on.in.gov/HoosierHomeland. You can follow us on Facebook and Instagram at IndianaDHS. We will see you in our next episode.